Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing 4 new cases of COVID-19, bringing our total to 221. Data shows us, as of this morning, 69 individuals are listed as recovered. There are 149 active cases. The number of deaths remains at 3. Public health investigations continue to confirm details, and information will be updated on our website as information is made available. Yesterday, 477 tests were performed at CADM Provincial Lab, bringing the total completed tests to 14,708. Manitobans should not interpret the current case numbers to mean our risk is reduced. These numbers may be a reflection of the benefit of our enhanced social distancing strategies and the hard work of Manitobans put in towards that. But I need to make this clear that now is not a time to let our guards down. These next few weeks are critical to Manitoba's response in responding to this virus and flattening the curve. We must remain vigilant with our social distancing strategies. We cannot misinterpret these numbers to mean that our risk is gone. We need to continue to adhere to these social distancing measures, to stay home as much as we can. If we go out for essentials only, to keep that physical distancing from other Manitobans. All returning travelers must self-isolate and monitor their symptoms for 14 days upon return to Manitoba. This remains vital, as we see importation of the virus is still a risk for Manitobans. So international travelers that are returning to Manitoba must self-isolate under quarantine order with very strict penalties for contravention. All travelers returning from other provinces in Canada must also self-isolate for 14 days and monitor their symptoms. We know that these last many weeks have been difficult for Manitobans. The news of this virus is often anxiety-provoking. We've asked Manitobans to take extreme measures to prevent transmission of this virus, but we must not let up. Some of these numbers are indicating in other jurisdictions, and very early indication, possibly in our jurisdiction, that our efforts are working. We must keep them up if we are going to continue our progress. We mentioned that these next couple weeks are critical in our response. I feel that this weekend is very critical. We may be seeing increased weather. We know that Easter and Passover are coming. There's going to be that urge to gather in large groups, large families, gatherings within homes to celebrate. I need to make it very clear that now is not the time for that. Our actions this weekend are critical to our numbers in the next week or two. If we let our guards up now, if we loosen up our social distancing strategies, this could compromise our ability to flatten this curve. So I know it's a lot we ask of Manitobans, but public health orders are in effect. We cannot have group sizes greater than 10. We must not be gathering in family get-togethers. Celebrate these virtually, celebrate them with immediate family members in the same household, but do not invite people over to your house. Do not sit Easter dinner or Seder with people from other households. Stay connected, don't be isolated, but now is not the time for gatherings, even within families. The message and the strong message is to stay home. Now is not the time to travel. Cancel all non-essential travel anywhere outside of Manitoba. Stay home as much as you can. Do not invite people over. When you go out for essentials, do so alone if you can. Maintain physical distancing at all times. Wash your hands frequently. Now is our opportunity to continue to flatten this curve in Manitoba. We can't let up. We can't miss our opportunity. Weather may be nice and a long weekend, and again, that urge to get out to the parks. But the message is clear. If you get to that park and you see many cars in that lot, you should turn around. Find someplace else, walk around the block at home. If you're in the park already and it starts to get crowded, it's time to leave. We must adhere to our strict physical distancing strategies. It's vital that people stay home when they're sick, especially healthcare workers. And when we say sick, we don't necessarily mean feeling dramatically unwell. Just a runny nose, sore throat, fever, mild cough, any sort of symptoms like that, we need people to stay home. Stay home, isolate 14 days, wash your hands. You can call Health Links for advice on whether you should be seen by a healthcare worker or tested, but it's vital that people stay home when they're ill. That's one of the best ways to interrupt the transmission of this virus. We know in many other outbreaks, many other public health conditions, fear and stigma often drive the infection. We've seen examples of that in this outbreak, unfortunately. And I want to remind Manitobans that fear and stigma will not help against this virus, but credible information will, knowledge will. Visit our website, manitoba.ca/COVID-19 for up-to-date information. Ensure we are staying up to date with this. Ensure we're practicing physical distancing at all times. Most importantly, stay home. This weekend, vital to our response. Stay home. Do not get together with large families. Now is the time to stay home. Do not attend faith-based organizations. Stay home. All of these examples, possibly some indication in our numbers, shows us that we are in fact not helpless against this virus. We are making a difference, but we need to continue to make this difference. If we loosen up, if we let our guard down, we may have lost any progress that we might be seeing right now. So thank you to all Manitobans, and thank you to our frontline healthcare workers who are doing a tremendous job. We need all Manitobans to stay home and protect our healthcare workers. And so thank you. I'm going to pass it to Lanette.
Good afternoon. So to date, according to our occupational health report, we have 20 healthcare workers in Manitoba who have tested positive for COVID-19. There are 0 cases in Northern Regional Health Authority, 0 in Southern Health Santa Sud, and 0 in Prairie Mountain Health. There are 2 cases in Interlake Eastern, and there are another 18 cases of healthcare workers in Winnipeg area, including 10 that come from the unit we spoke about yesterday at Health Sciences Centre. In addition to those staff at Health Science Centre, there have also been 4 patients on that unit who have tested positive for the virus. They are isolated and being cared for appropriately. Contact tracing has been completed all the way back to the initial case identified, and I can confirm that none of the positive staff have worked since April 1st. Staff who had close contact with any of the positive cases are now at home self-isolating, and that includes any staff who spent the majority of their working day on the unit. Staff who intermittently worked near the area or were present on the unit in direct contact, they have been assessed by occupational health. Asymptomatic staff are able to return to work using the universal personal protective equipment and continuing to monitor for symptoms. This outbreak is obviously very concerning to all of us, and protecting our staff and our patients is utmost important to us. The unit has undergone a deep clean in recent days to further the spread of the virus, and staff screening measures continue to be in effect, along with the universal PPE requirements implemented on April 1st. So I wanted to speak a little bit about PPE, personal protective equipment, because we are continually being challenged by the supply chain changes. Production and distribution processes and timelines to get our supplies have significantly been disrupted over the last couple of weeks. You have heard about decisions from 3M, who are supposed to deliver our N95 masks, and you've also heard about the federal decisions about ensuring that they manage Canadians in Montreal and Ontario and Alberta, but also Manitoba. So there's been a lot of changes, and it has affected our ability to access, order, and receive supplies. So as we spoke about previously, we have gone from our normal state where we manage with 60 vendors to now working with well over 600. And it's a mammoth undertaking around the clock to ensure that the continued shipment of supplies is coming into Manitoba. But like other jurisdictions that you read about or watch on the news, our supply stockpile has been significantly impacted by these pressures. And we can assure healthcare workers and the public that we continue to develop contingency plans. And it's a very fluid, dynamic process, but we are doing everything we can to make sure we continue to have access and get distribution for our providers. We're working with the province to explore every possible solution to these challenges. We know that the province is working with suppliers and with the federal government to bring additional supplies to Manitoba. Locally, manufacturers and companies have been asked to innovate and consider retooling to provide the necessary supplies closer to home so we don't have to rely on outside sources. And we continue to ask and receive local donations from companies who have been very generous and willing to help us out. So we thank you for that. And we will continue to work with everyone who wants to support us, and we'll continue working with every supplier we can find. We continue with the universal PPE, which was implemented recently in some areas, and it's going to continue to be implemented throughout the province with the goal of sometime in the week of April 13th that will be completed. So more information on that in the days to come. And it's also important to note that the implementation of that universal PPE involves extended wear in some appropriate circumstances. So it also does help not only just to protect the staff and co-workers, but also preserve our inventory of supplies. So the other thing I wanted to talk about was the community assessment clinic, which is now open at St. James Centennial Pool. So that is open from 9 till 5 p.m. And as we said yesterday, primary care and community health offices continue to be available for patients in need of care, with virtual and phone options available, as well as in-person appointments and walk-in services. So the new assessment clinic will offer primary care services for patients who have tested positive for COVID-19 or who are experiencing respiratory symptoms. And in light of the PPE challenges, the opening of this clinic is even more important as we take steps to ensure continued availability of services to individuals with respiratory symptoms and COVID-19. In addition to the clinics, these locations will also serve as designated testing sites to support additional capacity for testing. Similar assessment clinics and testing sites will be made available in the coming weeks as they are confirmed. Another notification about Cancer Care Manitoba. They have continued the suspension of breast cancer screening services offered through Breast Check for the next 2 weeks until at least May 4th. And the suspension of these services was proactively put in place last month to protect both patients and staff from the spread of COVID-19. Clients who had appointments scheduled will be contacted directly to have that addressed. And to be clear, this is a service that is for asymptomatic patients only. So if you have any symptoms or if you have any concerns, you should be talking to your care provider immediately, and we can work with you to make sure that you get access to what you need. You can also call Breast Check at 1-855-95-CHECK if you have any questions or concerns. Okay, last story. I spoke a lot this past month about how small gestures of kindness and support can make a big difference in how we feel. And some Manitobans have taken to posting supportive messages and works of art on their front windows for all passerbys to see. And I want to highlight 2 Manitobans who have worked to lift the spirit of others at a time when many of us really need it. And so I'm excited to start with 6-year-old Michaela Kostecki from Rossburn. Michaela and her mom have been making paper hearts and delivering them around town. And last week, she stopped at the personal care home in Rossburn and stuck hearts on the windows outside and waved to all the residents as she did that. And the residents loved this heartwarming gesture, and I loved it too. So I think that's great. And then I also want to thank Katrina Reyes of Brandon, who created a beautiful work of art on her front window of a healthcare worker wearing a Superman mask. And I think using your talent to show your appreciation and support for frontline workers was such a great thing to do at a time when people are feeling isolated and uneasy about the world around them. So these 2 Manitobans have provided some comfort and support to those around them. And I want to thank you both for making that effort. It's great work, and very proud of the work you're doing. So I will open it up to questions.
Thank you. And a reminder to our reporters online, you'll get 1 primary question and 1 follow-up each. And please reintroduce yourselves before asking your questions. From City News, Stephanie.
Good afternoon, Stephanie Lasuk with City News. Can you just tell us how long our current supply of PPE will last?
Yeah, so different supplies are, we have different volumes of different supplies. So I can tell you that face shields, surgical masks and procedure masks, hand sanitizers, we have a very good stock for weeks to months right now. Some of the items that we are becoming short on is N95 masks, gloves, and gowns. And so they're all a little bit different, but depending on when shipments come in and how much is being used, it could be in the next week or 2. So we'll have to make some decisions as to how we're going to distribute and get that out. But more is coming, we expect. So it could, we think it'll be a very short-term situation, but that's what we're facing right now.
Right, and then kind of on the other side of that, how much PPE did we lose or will not get as a result of the disruptions that you spoke about?
I don't recall the exact number of the N95s from 3M. It was a pretty significant shipment. And from the federal government, which I think is still under negotiation, we had ordered millions of supplies. We were the first one to put our supply order in, and we have received a fraction of that, more like a few $100,000 worth. So we know the supplies are here. It's just a matter of where it's being distributed. And I think it's just important for us to let the federal government know, and I know the minister and government are helping us with that, to make sure that we get what we need during this time.
From the Winnipeg Free Press, Carol.
Hi, it's Carol Sanders at the Free Press. Dr. Roussin, today the Premier was talking about enforcement measures and that there was going to be an announcement soon about how to implement enforcement measures. I'm just wondering, what needs to happen for your orders under the Public Health Act to be enforced?
Yeah, so it just depends. It can certainly be enforced right now. We know that there's been a number of complaints to our public health inspectors. And in fact, like most public health issues, there's been 100% compliance after the issue's been addressed by the public health inspectors. So this is, related to businesses. But the public health inspectors have the ability to issue orders under there, and violations of the Public Health Act could carry offenses. But right now we know that we're seeing a high rate of compliance once these businesses are being approached and advised on what they should be doing.
And this question is for Lanette. Some student nurses have had their practicums delayed or put on hold because of safety concerns about COVID-19. So they won't be graduating. The students say they want to be on the front line to help however they can. Is there anything that Shared Health can do or say, or is there any Shared Health on what post-secondary school decisions delaying graduation requirements are? Impact that's having?
Yeah, that's a good question, Carol. So we have sent communication to the educational institutions on behalf of all healthcare professionals, including nurses, that we certainly would welcome the support of students. Their clinical practicums continue in appropriate environments. Of course, we wouldn't force them to work with COVID-19 patients unless they were willing and wanting to. But there's lots of other work that can be done just on other units in the hospital, as well as health links and staff health and public health. There's lots to do. So ultimately, it is the decision of the educational institution. So I respect that decision, but we would support them, and we would make sure that there is mentorship. And you are correct that in delaying graduation, that does have a longer term impact on the healthcare system, but it is the decision of the institutions.
From Global, Marnie.
Good afternoon, Dr. Roussin and Ms. Siragusa. Marnie Blunt from Global News. For Ms. Siragusa, the COVID-19 assessment clinics that are for patients who have tested positive for COVID-19 and people who are experiencing respiratory symptoms, can you speak a little bit about some of the safety protocols in place there? Some people might have concerns about people who have symptoms but maybe haven't tested positive for COVID-19 going to a location where there are COVID-19 positive patients. Why would you have those two groups together, and what are some of the safety measures in place?
So safety measures would be that there would be social distancing, so the seats would be separated, people would arrive and receive masks, and the assessment would be done by the triage person, specifically asking, have you traveled? Have you any symptoms? Have you been in contact with anyone who has COVID? And then work through that process. So it's actually not a lot different than what would be at a regular place, at a non-COVID assessment clinic, but just that concentrated focus on that is your population. So making sure you're wearing your PPE and maintaining the protocols and the advice of our medical officer of health.
And my next question is for Dr. Roussin. The Premier has been hinting at an announcement on enforcement for people not social distancing that we'll hear about in the coming days. Based on what you've been seeing, and you've been saying people having football practices, crowded parks, Can you be specific on what type of enforcement or what this enforcement should look like in terms of fines, how hefty, and if there should be warnings given out and that sort of thing?
Right. So, so like I've said, most times these Manitobans follow advice, and certainly we need to escalate that advice because this is vital. This is a very important time for us. And so as these orders escalated, as our recommendations escalated, by far the most Manitobans are following it. And so we know with any situation, there will be some that maybe have not got the message or are not realizing how important it is to follow these, that Manitobans' lives are at stake if you don't follow this advice. And so moving forward, trying to escalate the urgency of this. And so that could include things like fines. The specifics are all pending on that. But as we know right now, the Public Health Act makes it an offense to contravene an order. And so there's provisions in there for offenses. And so moving forward, we'll have some more specifics to announce on how we're moving forward to enforce. Certainly, I want to, most steps are going to be to ensure messaging is out there, make sure that people are aware of the importance. And we're seeing that right now with the public health inspectors, where they're reporting 100% compliance with businesses that they approach and are providing them with advice.
From the Brandon Sun, Bud.
Hello, Bud Robertson, the Brandon Sun. For Dr. Roussin, a number of stores are really cracking down on the one shopper per household rule. But I've heard from some single moms and other staff have said that what are they going to do? They can't leave their children with someone. They need to shop. Do you have any advice, suggestions, what they can do?
Yeah, so I mean, the advice is to go out for essentials only and to go out alone if you can. So certainly there's going to be single parent families or families that are undergoing, other stresses that might not be possible. The issue is to do your best to limit taking large groups out with you. So some people might be very easy to do that. Other people might be close to impossible, but we're looking to limit the amount of people in the stores. So if alternate childcare is available, then do that. If it's just not possible, which in many cases it's not, then you're going to do your best, and that might mean taking people with you.
Okay, and my other question, this is for Lanette. Regarding the challenges to PPE supplies, with the first PPE, will there be any scaling back in some areas then of the requirement?
Yeah, so we're looking at what we need to do to make sure that our staff have the required PPE for the services that they need to deliver. So it's a good question, and we actually have a team working on that right now, and I would expect that tomorrow, if there's any changes in service delivery, we would announce that tomorrow. But I would also just say that it is really dynamic. So sometimes in this marathon that we're in, we are going to have periods where we have to make some changes temporarily until maybe we replenish a stock and then go back. So it's being responsive to the changes and the challenges that are coming to us. So we're evaluating that right now, Bud, and as soon as we have information, we will share it with you as we promise to always be transparent.
From CJOB, Diana.
Good afternoon, Diana from 680 CJOB. Dr. Roussin, we are clearly hearing not to gather with anyone at this point, no one outside your household, even with holidays coming up. But some people are still a bit confused with the 10-person max gathering rule. So in what kind of situation would a gathering of up to 10 people be acceptable right now?
Well, I can't really say it's acceptable right now. I would say that if your household contained 10 people or more, then that would be certainly acceptable. But social distancing should take place certainly if somebody is ill, to protect others in the house. But in public gatherings, it's not acceptable. And so that includes family gatherings such as faith-based gatherings, weddings, funerals. It's a contravention of the public health order in those circumstances. So it's really that getting the message to Manitobans that this is vitally important to them, the people around them, to our healthcare workers, and that this is not the time for family gatherings. Don't invite people over to your house on this holiday weekend. Stay home, do it virtually, stay connected. Difficult times, so make sure we're staying connected. But do not invite your neighbors over. Don't invite family over. Everyone stay home, and that's our best way to flatten this curve.
And as a follow-up, given everything you've just said, is there thought to maybe reducing the number of sort of people in that to maybe 5, or we've seen in other jurisdictions even down to a maximum gathering size of 2 people?
There is thoughts on that. So we're looking at, we know that this public health order is set to expire on the 14th. Prior to that, a lot of work is being done on evaluating what's happening in other jurisdictions, comparing it to our epidemiology, and then we're going to come up with some more recommendations shortly.
From the Winnipeg Sun, Scott.
It's Scott Bill from Winnipeg Sun. First question to Dr. Roussin. What's being done as opposed to for more creative ways for social distancing messaging, maybe for people who either aren't getting the message, or people who don't maybe have access to, I don't know, the technology of some sort, or even for, people outside of the English and French language, maybe New Canadians, that sort of thing. Just looking to see what's being done to kind of aid with the messaging for larger swaths of people.
Yeah, so there's some messaging going out there. I see some on billboards and that. So I know that at the federal level, there's some messaging even on TV from the chief medical officer of Canada. And so we're going to continue to try to get that message out. We're going to continue with efforts to increase visibility and enforcement of the orders. So to have more visibility of the ability to enforce the order out there. So passing that message on in crowded parks, trying to limit those large groups. So we're working on the messaging, and tied into that is work underway to perhaps be more visible with the potential to enforce.
Thanks. And just a follow-up. It seems the urgency of your messaging today has gone up a little bit, given the holiday weekend coming up and stuff like that. But you talked about the next few weeks being critical. Why is that now? The next few weeks? I remember at the end of last week it was, the next week is critical. I think you said now it's the next 3 weeks. Is that just because of the ever-changing nature of this virus, or why is that?
Yeah, it's a combination of that. It's what's happening around us. We see that we haven't seen that exponential growth yet, and so we've seen it in other jurisdictions. So we know that we are prone to it. That can certainly happen here. We've seen evidence of early community-based transmission. And then tied to that, we see the weather improving. We see a holiday weekend where normally people come together. And then on top of that, we've seen the last few days with relatively new or low new cases. And so it concerns me that Manitobans might interpret that as a time that we can lower our guards, that things are looking okay. And that's absolutely not the case. I expect many more cases in Manitoba. We cannot interpret this as a flattening of our curve. It's way too soon to judge that. I think that we can make some inferences that our work is contributing to this, that Manitobans' efforts in social distancing are certainly contributing to this. But the message has to be clear that we cannot lower our guards right now, that this weekend coming up is a potential for many gatherings. We have to avoid that. And in these next couple of weeks, in the overall outbreak, overall curve, are really going to be vital to see whether we can flatten this curve in the long term.
From CBC Radio Canada, Ezra.
Ezra Belot-Cousineau, French CBC. Hi, everyone. I wanted to know, Mr. Pallister is asking for the chamber to come back to the ledge for the 15th of April. Of course, he talked about instituting social distancing measures and all to make sure everybody's safe. Although I just wanted to know from your point of view, your perspective, what do you think about this? What do you think about the possibility that the chamber comes back in April?
Yeah, I think that's the all the government approach, and so certainly right from the beginning of this, all government departments have been working on a way to respond and prepare and mitigate for this virus, and I think that's probably just another step towards that. They certainly are realizing the things that I'm trying to relate to Manitobans is that we can't let our guards down right now. We see these numbers. It might give that false impression that we're out of this, and we certainly aren't. We need to keep up our efforts. We need to double our efforts to ensure we flatten this curve.
Okay, thanks. And as a follow-up, I wanted to know where are we right now concerning expanding our testing criteria? When it's going to be easier for people to get tested on a broader scale, please?
Yeah, so we're continually looking at that, looking at the capacity at the lab, capacity of swabs, viral transport media, all of these things. So we have some things in the works that we'll probably be announcing very soon about some expansion to that. And we continue to want to expand. We can see now that we're still getting fairly high testing numbers, but our test positive proportion tests has been declining as well. So that's suggesting that these lower numbers aren't simply a reflection of the testing volume, but we're not seeing an increase in the test positive proportion. But we'll continue to do that. Testing is certainly a part of our strategy, and looking fairly soon to announce a change.
From 102.9 CHTM, Navi.
Good afternoon, Navi Ball with CHTM. Apologies about the audio. My first question is, I believe, for Ms. Lanette Siragusa. In other jurisdictions, healthcare aides working in long-term care facilities who ended up working in multiple locations may have contributed to the spread of the virus in those facilities. I was wondering if you could clarify what sort of protocols are in place in Manitoba to prevent the spread in that sense. Are healthcare aides working in one location? How is that all working out?
Yeah, good question, Navi. So we are having those conversations. It is a reality in Manitoba that we have healthcare workers who go to multiple sites. So we know that's a problem. We know that's a risk, but it is also our reality, and that's how we operationally work. So those conversations are ongoing, and we're looking for solutions to either eliminate that or minimize that. But it's a challenge to make sure that everybody gets the services they need if we make those changes. So not impossible, but it certainly requires a bit more thought and a well-executed plan to make sure that everybody can get the services they need.
And another question in regards to the healthcare workers that were infected by COVID-19 in the South. What's the plan for when healthcare workers are infected by COVID-19 in nursing stations in isolated communities? Is this something that the province is talking about with First Nations Inuit Health Branch?
Yes, for sure. I believe that even the nurses who work in the First Nations communities, they may be employed with FNIB, but they still do They still are registered through the Manitoba College of Registered Nurses, and they would follow the same protocols, I believe, as any other staff working in Manitoba. So if they were showing symptoms or if they had an exposure, for sure they would be swabbed, they would be self-isolated, and then assessed through occupational health, or if FNIB has their own process. We are working with FNIB regularly to talk about how we can make sure we support the staff and the communities. So if that comes up, absolutely, we would help out in any way we could.
From CBC Manitoba, Bart.
Bartley to the CBC. Ms. Siragusa, could you just clarify on the outbreak at HSC? You mentioned a respiratory outbreak yesterday, but last week we heard of a patient and a doctor that was concerned with the GH4 ward. Which specific area was this one that you just told us about today?
The same one that I told you about yesterday.
Yes, but can you elaborate on what where that was? Was it the patient? And was this the one sparked by the patient last week or the doctor last week?
I believe they were all working on the same unit.
Okay. Dr. Roussin, the question for you. Is the province aware of any other cases of COVID-19 resulting from contact to Windsor Park School?
No, there's no connections to that school that public health is aware of. I know that we, public health investigation at the time also indicated that any individuals who may have been connected weren't in a infectious period at the time, and so we did of course look at the records, and we're not able to connect any case to that school.
From CTV Winnipeg, Michelle.
Hi, it's Michelle from CTV Winnipeg. Just wondering if any other staff or patients on that unit are now being tested that these tests have come back positive.
Certainly, they are looking very closely at who is showing symptoms. And if they are showing symptoms, respiratory symptoms, fever, cough, sore throat, runny nose, they would be swabbed and isolated.
Okay. And on a different subject, we're wondering about correctional facilities. Are there any further steps that are being considered within correctional facilities, like other jurisdictions have released low risk inmates?
Right, so you kind of broke away there, but I think you're asking about steps in correctional facilities, and certainly there are steps, and we've been working with Justice through that, and it involves the isolation of new clients before being admitted into the facility, and then also extra screening and precautions with the people working there. So there have been steps taken, minimization of visitors as well, and so these are all in place to minimize the risk of introduction of the virus there.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Dr. Roussin, I know you cautioned against reading too much into these statistics, but we've seen a big jump today in the number of recovered people, up from 21 to 69. What can we take away from this sort of statistical snapshot?
Yeah, so the jump in the recovered is all a function of time, and that's not usually a parameter that we are used to reporting. So there was a little bit of a backlog, but that's where we are currently now, is at 69. So I think, I don't want a big takeaway from this for Manitobans. I think if there's a takeaway, I think Manitobans should look and see these numbers, and that a lot of the hard work, a lot of the sacrifice that's being put in right now with these physical distancing strategies, with the public health orders, are very likely working, very likely having an effect. And so with that, we need to ensure that we continue, right? We actually double our efforts. And I really feel that these next few weeks are critical in our response to this. And if these numbers are reassuring, I'd like to deter anyone from thinking that, because we are very early on our outbreak. We are expecting to see a climb in cases, and so we need to ensure we're focused. Stay on this physical distancing, stay home, but know that these efforts are perhaps paying dividends. We can see imply some of that from here.
And as a follow-up, I'll ask the modeling question. Does this help with your modeling? Because now, as you get more outcomes, good or bad, you can gauge, the mortality rate, the recovery rate, things like that. Are you closer to releasing that modeling?
Yeah, certainly we're working on the models, and we have some very early models in place that seem fairly stable. But there's a lot of parameters that go in. We're continually adding more data to it to try to enhance the accuracy of it. And so we are getting there. We're hoping to be able to release some of that. But yes, absolutely. The longer you have, the more cases you have to direct your modeling, the more accurate you can hope it to be.
From the Selkirk Journal, Brooke.
Good afternoon, Dr. Roussin and Ms. Siragusa. It's Brooke Jones with the Selkirk Journal. Compared with other provinces and countries, it appears Manitoba has worked hard at limiting the number of positive tests and unfortunate deaths linked to COVID-19. Most cases have been linked to travel and less through communities. Organizers of public events and sporting competitions have used June 30th as a benchmark to either cancel or postpone events such as provincial high school championships and the Manitoba Marathon. Athletes from Manitoba are going to compete at the Region Nationals track and field meet in Nova Scotia in August, but this sporting event has now been cancelled. We can all appreciate the time and effort it takes to plan and organize events. As we move closer to June, will you now advise organizers to start cancelling or postponing events in Manitoba scheduled for July and August?
Well, it's a good question. It's a difficult question. I think that we're in a critical stage right now. So we're focused on this wave, on to flatten this curve right now, and so we're doing what we can. It's really difficult to predict what we're going to look like in July and August. I think that certainly we're going to have some sort of physical distancing strategies in place at that time. It's unsure to know at this point what they'll look like. So it's a difficult question. I can't give a specific answer to that. What I can say is that these next few weeks are critical, that we need to double our efforts. We need to stay the course with our physical distancing. As we start making it through here, as we get a better judge of that curve, then we might be able to offer more predictions on a few months out. But we need to see what we can accomplish during these next few weeks.
Thank you. And my follow-up, I can appreciate that you can't necessarily speculate. However, as a society, if we all do our part during the next couple of weeks and the curve flattens and we eventually see 0 new cases sooner than later, how much time would you anticipate would be needed to be at a 0 level or a comfortable level before schools, public and sporting events, and non-essential businesses can resume? A week, 2 weeks? I know the next couple of weeks are very important.
Yeah, and so it's going to really depend on the specific epi and as well as the epidemiology around us, right? Because no matter how much we try, we're not going to be in isolation from other areas. And so as we see our curve, as we see really the real measure is going to be the demand on our healthcare system. So if we're able to manage the demand on our healthcare system and it's not overrun and we see that the capacity is maintained, then at that point we may be able to back off on some of the social distancing strategies, monitoring very closely. And so I'd say the biggest indicator is going to be the demand on our healthcare system and whether we can maintain capacity.
From the Carillon, Greg.
Hi, Greg Vandermeulen here from the Caroline and Steinbach. We're still getting a lot of questions from the public regarding the breakdown of cases by health region just because of the disparity in sizes. Southern Health is close to 30,000 square kilometers. I'm just wondering if you could respond to people who are wondering why rural Manitobans are being treated differently than Winnipeg residents when it comes to the access to data and the numbers.
Yeah, I wouldn't classify it as that. We're releasing it by health region, so Winnipeg happens to be its own region. And again, the messaging is on this matter is clear. It should not matter. Right? Everyone right now should think that that virus is in your community. You should stay home and practice physical distancing. To know that this virus is in 3 towns over shouldn't affect your decision to self-isolate, to stay at home. Knowing it's in your community shouldn't change your decision. So in a way, it's it may cause many issues. It may give someone a false sense of security if they see this virus in many of the communities but not in theirs. And so public health releases data mostly based on whether there's a use to the public. And so certainly we'll do some geographical breakdown. But knowing that the virus that you have a confirmed case in your town or community shouldn't change your practice. Right now, all Manitobans should be staying home as much as they can, whether you think there's a case in your community or not. If you go out, do so for essentials only, maintain physical distancing. And so whether you know about cases or not in your town, those are the actions you should take. And so that's why public health isn't releasing them at a more specific area.
Just a quick follow-up. Are you worried that people will react that way when they see the number of cases in over such a wide area that they may assume that none of those would be anywhere near them?
Well, it's not a time to assume. So I mean, we could put it down and be specific where it is, and so those people who would make that assumption might act on the knowledge that they know exactly where it is, so they don't feel at risk. We're all at risk right now. This is a significant threat to the health of Manitobans. Manitobans have been doing a terrific job at physical distancing, and we can get a hint of that in these numbers. But you need to assume that virus is around, and you need to stay home. You need to practice physical distancing. You need to wash your hands at all time. Whether there's a report of a case or not in your community or the community next to you shouldn't change that at all.
We have a few minutes left and time for just a few more questions.
Has anyone recovered, any COVID-19 patient in Manitoba who was on a ventilator recovered?
I don't have that information. We're going to try to get that breakdown. I've been talking about having that breakdown of hospitalized and ICU clients, those type of recovery.
Hi, Carol at the Free Press. I'm just wondering, Lanette, if you can please give us a breakdown of the respiratory outbreak in HSC and the workers. How many nurses, how many doctors, workplace, I don't know if you can break that, give us of who was being tested.
Yeah, I'm not going to give an exact breakdown of each, but I can tell you that it is a mix of physicians, nurses, and healthcare attendants, support staff.
Why can't you give us the breakdown?
Well, I don't even know if I have it in front of me, Carol. I have seen it, but I can't verify that it's in my notes here.
If you had it, would you give it?
Yeah, I guess I'm not sure why I wouldn't give it to you, except I don't have it in front of me.
Did you get it?
I can see what I can find and get back to you, Carol.
Any further questions?
Yes. Department Davis here at CBC. This is at what level of I realize this is relative, but at what level of sickness or illness or indicators is required for a COVID-19 patient to be hospitalized, to remain in hospital once they seek medical attention?
Yeah, it's a variety of issues there with it. I think with the COVID-19 clients, probably the most common thing would be hypoxia, where they're not able to get enough oxygen into their bodies because of a lower respiratory infection. So that's probably the most common thing we would see with COVID-19 individuals. I don't really have a breakdown of those type of things, but that's a typical thing we would see with this disorder.
And what's the protocol to get them to hospital? They go by ambulance with a paramedic in protective gear, is it a family member? How do you advise people to go if they need to go?
Yeah, it would depend on the circumstance. So people calling health links, if they are ambulatory, if they don't sound too unwell, then they would go to the hospital in the usual fashion, calling ahead. But if they were critically ill, then certainly the ambulances and the staff there are well prepared to protect themselves and the client and get them into care.
Thank you, everyone. This concludes today's media briefing.
Thank you.